Good afternoon, everybody. So this is Denver. I'm going to talk about the one of the projects assigned for us, assigned for me to present. So here is the here is the background, so you can guess what kind of disease this man or young man encounter. So you can see the picture here. I have a picture uh, on the background. So the here is the one. His name is Jason W, and he was 27-year-old young man, and then uh, he was admitted in Mount Carmel Hospital in Ohio. So he complained about that fever, headache, palpitation, abdominal pain, and diarrhea, and then he went to the hospital for because of this reason. So when he faced the doctor, with the doctors, and the doctor asked him about that, the have you ever been visited to the country outside United States? Yes, he visited his parent back in Africa. So when he come back, he was caught by some symptoms, and then he was. Let me tell a little bit background about him. He worked as a cashier at Walmart, and then uh, family of four, and then he was helping the parents back home, and then sometimes he occasionally come out a night out to drink with his workmates and the friends once in a month. So after that, once he uh, tell the symptoms to the doctor, and doctor order the test, doctor order the list of tests to verify his diseases, what organism make him sick. So audience, can you guess uh, what organism or what diseases he encounter? Anybody can guess it? Okay, let's do the test. So what the test doctor forwarded, and according to the symptoms, he occur or he get like a fever, and then doctor ordered to take a body temperature, and then body temperature was measured, and a patient complained about palpitation. His EKG was ordered, and then he complained about diarrhea, and blood analysis was ordered to check the body iron level, and his symptoms, symptoms shows like pale and yellow. So doctor ordered to liver enzyme test was performed, and next patient complained about abdominal pain and diarrhea, and then his stool culture was ordered to test. And the next one is the results. After doing all these tests, patient was in a bed. So the doctor, and then all the lab technician find the results, and then the doctor told the patient that the body temperature was confirmed a fever of 102 degree, 0.5 degree Fahrenheit. He has a high fever, and then EKG showed he has a repeat. High. That's called tachycardia, um, a high heart rate shown to be 120 and 120 bpm, and liver enzyme test came out normal, and stool culture test found positive for Salmonella enterica serotype, and results show a low level of calcium, potassium, and RBC. So diagnosis. Typhoid fever is associated with the fever caused by Salmonella enterica typhi bacteria, and this is the it has an incubation period for typhoid fever like 8 to 48 hour. And after collecting all the detailed observation, patient was treated with antibiotics with a ciprofloxacin and ceftriaxone. And to avoid dehydration for electrolyte loss, he was treated with the IV fluid in the during his uh, the hospital. So the outcome was that patient was kept under observation in a hospital for 10 days, discharged with the full recovery after treatment after the antibiotics, treated with the fluids, IV fluids to help dehydration for electrolyte loss, and asked the patient to follow up every after 2 weeks. And then patient came back to the normal. He was came back to the normal life after 2 weeks, and he started his job back to the Walmart. And then doctor suggested him to proper follow the proper sanitation procedure and while handling the food. And then and also doctor order like a immunization for traveler to endemic areas, so that whenever you travel from outside the United States, uh, the patient was asked to put the immunization. So this is the outcome for the result. So the summary here, the Jason W was the boy, and he worked in a Walmart, lack sanitation when he traveled back to the Africa, and those countries, especially Middle East, Southeast, and Africa, they lack. I mean, they have a poor hygiene. And then salmonella is ingested in contaminated water or food, and bacteria passes through the stomach and it hurt the small intestine. And then is the fever was triggered and then by abdominal cramps and diarrhea, and he was provided antimicrobial against the typhoid fever. And here is the one we find that he has typhoid fever. So this is all this about the patient diagnosis and how he was treated in the hospital. So these all are the procedures as a nurse, as a doctor, they perform in the hospital. Thank you, and have a good day.